Hello everyone and welcome back to RAK Hospital podcast. My name is Victoria and we are hosting a special guest with us today, Dr. Adil Rizvi. We are going to discuss a very common topic, which is varicose veins. So Dr. Adil, the first question I would like to ask, what are these veins and how do they form?
So thank you for having me on the podcast. So let me explain to you what are actually varicose veins. So varicose veins are actually dilated veins, but not just any dilated veins is varicose. So varicose will have some problems inside the veins. So they have unidirectional valves which are present in the venous system, and this varicose is they happen when these valves malfunction. So basically, you have a high pressure system in the veins, superficial veins, which are supposed to be low pressure systems, and that's why they appear engorged, may appear like bluish or pinkish in nature. So usually just below the skin. This is what varicose vein is actually.
Okay, so are these just as a cosmetic concern or this is something more serious about them?
So to begin with, yes, of course, they begin with maybe unsightly veins. So this is the beginning part, but they usually don't remain that way, and it can gradually progress to engorged veins with venous insufficiency, what we call when the valves start malfunctioning, and that is the point where it ceases to be a cosmetic concern and actually becomes a medical concern. Although not immediately life-threatening, but once you have such dilated veins, you can have swelling in the legs, you can have skin discolorations, which can render actually your legs not very useful. So it can lead to problems, medical problems. Yes.
So how common are varicose veins?
So varicose veins are fairly common. So some studies, the incidence may go up to like 30%. So it's a very common phenomena which we see. But to begin with, I must say that a lot of them are just mild form. So they usually don't progress to a point where it requires medical attention or medical care or treatment, but they are fairly common.
What are the main causes to develop the varicose veins?
So there are subset of risk factors, I would say, which can increase the incidence of varicose veins. To begin with, genetics, one of the strongest factors that is there. But just genetically predisposed does not mean that any person will have varicose veins. So there are environmental factors which will dictate who gets varicose veins. So people with jobs which require long-standing periods, that is one which can lead to varicose vein development. Apart from this, there are other factors. For example, pregnancy in females, overweight, obesity could be one. And there are other factors, for example, leg trauma, previous leg surgery. So all those things can really affect those veins, and it can lead to development of varicose veins.
So how do lifestyle factors affect the veins? Including, for example, as you said, long hours standing. How do they affect the overall health condition of the veins?
So as I'm not sure if everybody knows it, but I would like to kind of explain how the veins work. So veins are carrying blood from the peripheral organs back to the heart.
Yes.
Unfortunately, they don't have any pumping mechanism on their own. So what happens is the pumping that happens in the vein actually happens through muscle contraction.
Yes.
So when lifestyle plays a very important role, how varicose vein develop. So people who have a very sedentary lifestyle, who are not walking enough, or who are not moving their legs enough, now those people are more prone to get varicose veins. Why? Because the pooling of blood happens. You don't walk around, so the muscle contraction is not there, and this will cause pooling of blood. This pooling of blood actually causes the veins to distend and the valves to malfunction, and this is one of the reasons why people with sedentary lifestyle are more prone to develop varicose veins. Apart from this, there's other reason. So sedentary lifestyle can lead to weight increase, unhealthy lifestyle, smoking. All those actually affect the elasticity of the veins. Now, this elasticity can really be one of the causing factors why people develop varicose veins. So having an active lifestyle is really important to keep your venous system healthy.
So following your thought now, so what would be the best way to actually improve the elasticity of the veins? in this case? So you mean sport or anything else to adopt?
So the bare minimum will be a walk.
Yeah, walking,
Okay,
sport.
but any other sport like swimming or maybe running, whatever, it helps. It definitely
Yeah.
helps. Cessation of smoking could be one of the ways how you can have a healthy
Yeah.
venous system, and in fact, not just the venous system, healthy connective tissues. So like a lot of viewers will like to hear about it, and smoking can really degenerate the connective tissues, and it has implications not just on the veins but all over the body, facial skin to
Yes.
everything.
Yeah,
Hairs.
everything. Wherever I go to a doctor, the first question is, "Are you smoking?"
Yeah, this is something that is really avoidable, and it can have a real difference in the lives of people.
That's a huge factor. Yes,
It's a huge factor.
yes. I heard also smoking, alcohol. Yes, that
Yes.
will also.
I'll rank smoking much, on top.
Yeah. So now looking at your expertise, what symptoms should we look for to prevent those varicose veins in our body? What should we look for in our body? How to prevent them?
So one is the visual clue, as we had already discussed. So
Yeah.
these are visible things just
Yeah.
under the skin. So in the beginning, it will just be a dilated, engorged vein. Okay, so that is the first clue that a person might have varicose veins.
What do you mean the color at the beginning? It starts
Not
with the color.
the visibility of veins. So if you have a dilated vein, of course you can
Okay.
see it. So that's the number one.
Okay.
That's the place where like everybody or most of the people will start noticing that they have extra enlarged
Veins.
vein.
Yeah.
Now, to begin with and to follow up with this, when it becomes kind of like the swelling comes or the leg feels very fatigued, so these are add-on symptoms that can happen with
Okay.
varicose veins. The fatigue in the legs is more after standing for long periods of time. This is very specific to varicose veins, these kind of symptoms. So to begin with, yes, of course, the visual clue. Okay, you can see the dilated veins. Secondly, you could have mild swelling, fatigue legs. So these are the common symptoms that people start noticing. In very advanced cases, yes, bleeding can happen. In very advanced symptoms, ulceration, breakdown of skin can happen. So that is kind of like very advanced features.
Oh, that actually reminded me of one story. So one of my neighbors actually was knocking on the door one time, and once we opened the door, it turned out he was maybe 65, approximately like this age. And I remember I saw so much blood because he was just scratching his leg, and by accident he cut his vein with the nail, and that was incredible because I could have never imagined that just because of scratching with the nail you can actually cut the vein, and that was so drastic, dramatic. We couldn't even believe what we were seeing. And he said that he was actually watching TV. Incredible. And he said that he was just watching TV, and just subconsciously he was just scratching. That's it. And then suddenly he sees the blood, and he called for us, for help, because he was so much in shock. And for people who are not used to that, used to seeing blood, everyone was just terrified. What to do? Quickly call the ambulance. What to do? Just put the pressure. Oh, that was insane. This is the first time that I actually realized that varicose veins could be really dangerous by the end of the day if you are not really aware of what could happen eventually.
So I would like to add to this. So varicose veins in advanced stages, they cause skin inflammation and skin changes, which could be very itchy.
Yes.
And it leads to scabs, and one of the ways how we can have a torrential varicose vein bleeding is because of scratching. So there's inflammatory changes, the skin changes are there, and below it is a dilated vein which is very thin walled, and
It broke.
because of the inflammation there's a tendency to scratch that area,
Yeah.
and it can really break that skin over the vein, and it can lead to catastrophic bleeding. Fortunately, such complications are very rare, but this is the reason why varicose veins should not be completely neglected.
Yeah, so you mentioned actually before we started recording the podcast that you had a case yesterday, also similar, right? That the veins were bleeding.
Varicose vein bleeding can happen, although rare. Good thing about it, it's very easy to control if you know what to do. So the simple treatment is you need to elevate that leg
Yes.
and put compression.
Yes.
So these two things can be life saving. So
Mm.
this is something that I want to convey to the viewers, that if you are witnessing something like this, these two simple measures can really save lives.
Yes, it could. I mean, that's what we did that time. That was I think that was 11 p.m. Can you imagine that late at night? And he was just watching TV. So thankfully we were at home. So we said the first thing that comes up to our mind, okay, elevate the leg and quickly call the ambulance and just put the pressure right above the knee, okay? So that's it what we could do. And I think, thanks God, we were home, because otherwise I don't know what could have happened. He was so terrified, because this is the first thing that happened to him like that. He didn't know what to do. I remember his eyes wide open. He was looking at us like, what? I don't know what happened. Now I can actually laugh and smile, and that was just crazy experience. But that time, oh my God, back then we were just terrified.
No, I do understand that torrential bleeding can be very dramatic, so
Yes.
it tends to scare people.
But under the pressure, you could see the blood.
Yes, so the treatment to this part is you should put pressure directly to the place where it is bleeding and elevate.
Yes.
So elevation will decrease the pressure in the veins, and pressure will stop the bleeding. So these two steps are critical.
Yes.
And one of the things that you need to remember is to give the pressure where the bleeding is happening, and not above, not below. So this will be the better idea for varicose veins.
Okay.
Unlike some of the bleedings where
Yeah.
you need to give proximal pressure, means above the wound or something. But in this situation, the better pressure will be to apply the pressure at the place where it is bleeding and elevate the limb. That will take care of the varicose bleeding, and it's fairly easy to do this. By the time the ambulance or medical help arrives, this is something that you can do.
Yeah. Yes, it was pretty much fast, actually. The ambulance came very quickly, and what they did exactly what you said. And they just told him to go to a doctor the next day in the morning, that's it. But I remember, actually, there was one case that my mom told me that she heard this story from her great-grandma. It comes from generation to generation. So back then, people didn't have money to go to a hospital, or the hospital was too far from the home village. So people, for those kind of cases, I mean, not the bleeding varicose veins, I'm talking just about the veins overall. What they would do, they would put some honey on the skin as a balm, as a lotion, and it would soften the veins. That was one of the
Naturopathies or natural treatments.
Yes.
I would kind of like disagree to this part in general. Usually, applying lotions or balms over the skin doesn't really help the skin below it or the vein.
But the honey.
Although yes, it can have some effect on the dryness of the skin or the inflammation over the skin. So yes, it can help to a certain extent, but it is not something that will cure the varicose veins or mitigate the symptoms enough.
Yeah.
So this will not be kind of very acceptable treatment for varicose veins. So most of the topical ointments and other things, usually they really don't work on varicose veins. It can do some, make the skin softer, cool down the inflammation a little bit. That's all that can do. So here, better options are compression stockings. So compression stockings, medical grade, which can give
Yes, I heard those.
compression between like 20 to 30 millimeters of Hg.
Yes.
So those are kind of like things which can apply pressure externally so as to compress the vein and empty them out and reduce the pressure in those veins.
My grandpa had those ones. Even the socks, right? The
it's
socks
a
that
socks.
are right
It's a
above,
tight socks basically.
right? Yeah. When one should consider seeing a doctor.
So people see doctors for like a lot of things, and to begin with, I would say, even if your veins are not looking good, you can come to us and we can evaluate. So starting from cosmetic concerns, because usually these are the ones that people notice first. So people who suffer from varicose veins, the first thing they will notice is dilated veins. So initially it might just be a cosmetic concern. So a person might not like the way the leg is looking or the vein is looking, so they can come to us. But there are other sinister symptoms, like for example, leg getting a swelling, or legs getting too fatigued
Yes.
by the end of the duty hours or something.
Yes.
So these are things that one should
Yeah.
really consult a doctor. And then again, in advanced stages, of course, you have to come to the emergency immediately if you have any bleeding or sorts. So these are the things that you should really consider, like as symptoms of varicose veins, and then you should really consult a doctor there.
So what does a typical evaluation include if we go and see a doctor?
So to begin with, a detailed history, detailed examination is required. So we assess what are the symptoms the patient is facing. Then we check for the dilated veins, and we also do some clinical tests to evaluate those veins, and also followed by venous Doppler. So this gives us an overview of the severity of varicose veins, and depending on that, we can advise treatment to the patient.
Okay, so what are the treatment options available at RAK Hospital?
So to begin with, not every varicose veins will require any sort of surgery or something. A lot of varicose veins are managed just by conservative means, which means that we coach the patient about lifestyle changes. We prescribe these compression stockings or the tight socks that I was discussing with you before.
Yeah.
So these are the things that can take care of a lot of varicose veins. It is only when we find chronic venous insufficiency, which is actually when the valves are malfunctioning in the veins. This is the time that patient really requires a surgical intervention. And by surgery, I really don't mean that, nowadays you need big cuts or anything.
Yeah.
It's mostly catheter based. So we just make a prick in the vein and pass a guide wire to do all the surgery. So nowadays it does not really require big cuts.
Okay, so the difference between minimally invasive treatment comparing to a standard procedure, what is the difference here?
So nowadays, most of the surgeries that we do are minimally invasive. In fact, these are much better results than open surgeries.
Yeah.
So in olden days, there were big cuts where the vein used to be ligated and removed or stripped off. That led to a lot of pain and disfigurement, which nowadays is not required. In fact,
and then treatment after all, right? To
Yes.
Recovery, I mean, process.
yes. So these minimally invasive techniques allow us to operate on veins without giving any cuts. Just hardly 1 millimeter prick is there, or small minimal incision is there, just enough to introduce a guide wire into the vein. And that is all that is really required. And the downtime is minimum.
Yeah.
So, a patient will require a day or so of rest, and that is all.
Oh, great.
And I have patients who were working on oil rigs and firefighters and policemen who went to duty, active duty, 2 or 3 days after their surgery. So these days, this method is very quick and very less invasive.
There's such a relief. Oh, yeah, great.
Yes.
Yeah. Oh, much better. Because you just imagine if firefighters, for example, they would have to wait or recover. I don't know how many weeks it used to be before. I mean, weeks, I assume.
Yes.
Yes?
It takes time, and
Insane.
it led to a lot of disfigurement also, unsightly scars and all.
Yeah.
Nowadays, it's barely noticeable.
So you mentioned there was a prick, and then you just what do you put exactly? In
So
the vein? I don't understand.
we pass a wire,
Okay.
and over the wire we pass on a delivery catheter, and with that we can deliver maybe laser or glue or whatever to close the vein. So basically, it does not really require cuts.
Oh, now I understand. Okay.
So basically, it's endovenous treatment where a small wire is introduced into the vein, and that kind of closes the vein from inside without having to really remove the vein.
So you see lots of blood, actually.
No, there is with minimally invasive, there's hardly any blood loss.
Great. You see.
Yes.
Yeah. Doctor, the last question for today. What are the common myths that we usually hear about the varicose veins? I'm really curious about those ones because people talk.
Yes. So there's certain myths that is very prevalent. First is, when you go see a doctor, you don't get surgery prescribed all the time. So a majority of varicose veins will require conservative management, and that will not require any sort of surgical intervention. And it will just lead to maybe advice on lifestyle modification, advice about compression stockings, or some other, like for example, weight management and other things. So whenever somebody notices varicose veins, it's better to consult a doctor and get the advice done. So a lot of people are just frightened because, if they go to the doctor and the doctor will prescribe them surgery, and then that's the reason they are avoiding. So to all of our viewers, I would like to explain that it's not the case. So this is the biggest myth that circulates around.
People are scared of surgeries overall,
Yes,
right?
yes.
Yeah.
The other myth that circulates around is a confusion between the deep vein and the superficial veins. So varicose veins is the superficial venous system, and it has nothing to do with the deep venous system. So a lot of people get scared about pulmonary embolism and other things as soon as they hear about vein problem in the leg. The other thing, they search the internet and they come up with the pulmonary embolism, which is a fatal complication of deep vein thrombosis, but they confuse between deep vein thrombosis and varicose veins. So this is myth number 2. I would say that this is something that is completely unrelated. So anybody who has varicose veins has no chances of pulmonary embolism. So these are two different diseases.
You type on Google and
Yes,
it turns out that you
yes.
have everything, whatever comes.
Yes, so sometimes it's very difficult to decide what's actually happening just by searching on Google, or maybe asking ChatGPT.
Feeding us with fear,
Yes,
right?
so this is something that
Crazy.
again, one more thing is that yes, pregnancy can lead to an increase in varicose veins, but a lot of times that the dilated veins that people see during pregnancy is not actually varicose veins. It's just distended veins, which normally functioning valves. So these do not constitute varicose veins. So a lot of females get concerned when they are pregnant and they see dilated veins, and they think that it's varicose veins. So usually this is not varicose veins. So there's nothing to really worry about. What I usually advise is once the delivery is done, maybe 6 to 8 months after the delivery, we can evaluate. Anyways, compression stockings is helpful anyway. So anybody who has any cosmetic concerns can wear those stockings. So another myth kind of originates from this use of stockings. And what is that? So a lot of people think that they have been using this compression stockings for a year or 6 months, and that should kind of take away the varicose veins.
I was about to ask you this question.
Yeah, so this is something that doesn't happen.
Okay.
What it does is it provides symptomatic relief, so people will not get leg swelling or will not get leg fatigue.
Yes.
The varicose veins which are already there, they don't subside just because you're wearing compression stockings, although it can help in preventing further aggravation of the dilated veins, but they will not regress. So if you are looking for clues that, okay, I'm wearing compression stockings for a very long time now, these varicose veins are not going, so this is what it is. They will not go just by wearing compression stockings. It may not progress, the symptoms will be better, but they will not progress. So this is one of the myths that is associated with the treatment part.
So you have to just stick to those stockings and
Compression stockings help relieve a lot of discomfort.
yes,
And it can help healing of certain ulcers. It provides relief,
good,
but it is not an alternative for surgical treatment.
of course. So you can't heal them, as you said. It's just preventing from an inconvenience, right?
So word healing will be a very loose term here. So healing will include control of symptoms. Yes, of course, the symptoms will be controlled.
Yeah.
But if you have an idea that by wearing compression stockings, these varicose veins will completely disappear, so I regret to say that will not happen with varicose veins. They will not disappear just because you're wearing compression stockings. But it helps. It helps in controlling the symptoms.
Yeah. Yes. And I mean, as long as there's something that could relieve us from this inconvenience and the pain, because I remember my grandpa used to have this swollen here, the ankles, I remember, so that he would have to wear them every day. And I when I was younger, I remember I asked him, how long do you have to wear those ones? He's like, actually, all the time. I mean, not at night, of course, but I mean, even when he goes to work. So he had to actually stand for long hours. So again, coming back to the beginning, you remember of our podcast, we were talking about the lifestyle. Of course, long hours standing, and it could lead to such symptoms like swelling legs, and then varicose veins eventually. Yes, I could see them. That was pretty much for him inconvenient. People usually complain about those ones.
So a lot of professions nowadays require people to stand long periods of time. We have patients who were nurses or salesperson,
Yes.
and even doctors. When we were doing surgery for 4 hours, 5 hours, we have to almost stand still
Yes.
for that duration of period.
Yeah.
For people who are in similar professions which require them to stand for long periods of time, I strongly recommend them to wear stockings.
Yeah.
So that is a good way how you can prevent leg fatigue and prevent to a certain extent development of varicose veins also.
Thank you, Dr. Adil, for being with us today. Appreciate that. And thank you to our listeners in our episode, and see you in the next one. Thank you.